Hi, I'm Mark Davidson. I'm the Superintendent of Medicine Public School Division, and today I want to talk about the power and the meaning of individual stories and the story of community, and how together they shape our future as individuals, as community. I want to talk about what it means to attend to the needs of individuals by attending to the needs of the community. We've spent a lot of time in our community working around and thinking about the challenges that many face related to COVID, but really challenges that have predated COVID by quite a distance. We spend a lot of time in school divisions thinking about, concerned with and acting on ways to support young people in dealing with the traumas that they've faced in their young lives, helping them build resilience, and be able to use those tools associated with resilience in order to take control of their lives and overcome challenges. We're also very much aware of the fact that many of the challenges that individual students face are born out of the challenges their own parents and loved ones and broader family face themselves. There is often a continuing flow of trauma where one passes it to the next without any intent to harm, but because their lived experience traps them in a cycle. We have the ability to interfere with that cycle in the way we address the needs of individuals. And I believe we have the ability to address that cycle in the way we address the needs of our community. What's required, though, I think, is a greater understanding of what it means for young people to experience trauma, what it means for people who think they have dealt with their own to actually truly come to terms with it, and then for us to work together to build coherent plans to address community and individual need. Others more knowledgeable than I in the area of social science and psychology and mental health will be able to talk to you and probably have about adverse childhood experiences. Those are a set of experiences that impact the development of young people and can have a long-term impact on their physical and mental health. These are factors related to forms of abuse like physical, sexual, and emotional abuse, neglect, and occurrences that happen in young people's lives, ranging from witnessed violence toward a parent or caregiver, imprisonment among a family member, food insecurity, lots of transitions from home to home, divorce, and so on. A growing number of young people that we serve experience higher and higher ACE scores, exceeding 3, heading up toward 10, which is the highest in that scale. But those children come to us really ready to live and to learn and to do great things. They are not themselves broken. They're young people who have a set of experiences that they will carry with them. And it's our duty to try and sort out how is it we help them build skill, take that skill with them so that they can put those experiences in a place that allows them to live and live fully and not perpetuate that cycle in their own experiences as adults. So in our schools, we function on something called a Continuum of Supports. And at the universal level, the base, the services we provide to all, we work really hard to try and make sure that we engage in capacity building. In fact, we have a project that's a partnership with Alberta Education and Alberta Health called Mental Health Capacity Building Projects. And the intent of those projects is to help our students build skills around resilience, to be able to tend to their mental health, to be aware of what they need, to be able to ask for help, and so on, so that every student in a school gets the opportunity to be seen and supported in that way, and hopefully not miss that opportunity to learn. Where we're challenged as a school system is that there are students for whom universal supports alone are not sufficient. And when we reach out to community in order to provide supports for those students, we encounter a new challenge, a broader challenge in the story of community. And that new and broader challenge is this: there are not enough resources to support students who are not adequately served by our passionate and thoughtful attention to universal supports. And there are not enough supports, not timely enough supports, not robust enough supports for families, so that parents and guardians who sorely love their children, but who are contributing to their children's challenges unknowingly, or because they're in a cycle they cannot break, are unable to secure the support they need. We are aware of the fact that in order to help young people build resilience and get to a space where the challenges associated with adverse childhood experiences are ones that they can deal with and frame in a way that allows them to, as I said before, live real positive and productive lives. When we think about primary, we think about the universal supports that I mentioned before. In schools, it looks like child and youth care workers who provide presentations in class about a wide range of things, from nutrition to asking for help when you need it, to it's okay to feel sad or upset, and how do you express it in a way that allows others to support you and doesn't push them away. How do you build positive relationships with your peers? They'll engage in work with the supportive family school liaison workers and counselors to help young people come together and resolve challenges, and to see that anger or a bad moment with a peer doesn't necessarily that person has rejected you, that there's a way back from there. Then it's about relationship. They provide programming. They support teachers in providing programming in health and physical education and language arts, all about trying to help young people build that broad base of an understanding of their own agency around their mental health and wellness. At the secondary level, we're talking about services within schools and available to people in community that key in more on the specific challenges that that student might be experiencing. And so in our schools, we have family school liaison workers who are registered social workers who are able to connect with families and with students and try and build a bridge between school and home, so that family can hear from someone other than a teacher or a person of authority in a school that there are services available, that we're there to help, that their child matters to us, and that we're happy to connect them as a family to services that might support them in being able to create a more calm or safe environment for their children. And then finally, we have young people whose mental health has been so impacted by their experiences, and our ability to get supports to them quickly enough, or the number of transitions have prevented us from building relationship to the level or fast enough in order to move them to the next level of support. They require a level of support from mental health professionals and community therapists and psychiatrists, psychologists, and so on. Where we really experience challenges as a system is that we are well positioned to provide primary supports. We spend an increasing level of education dollars to provide secondary supports, and we don't begrudge that at all. But where we struggle is to help children and families, youth and families, young adults and families, to access tertiary supports in community. I'll share with you my own story as a way to connect, because as I said at the start, I want to connect individual story to the broader story of community. You'll have seen the graphic regarding ACE scores and the components of it. Generally, people score that on a scale to 10, and many will score a 1 or a 2. Mine is a 7. I was born to a 17-year-old mom and a 33-year-old father. She married my dad in order to escape being poor. 4 years prior, she crawled through a motel window with her little brother and little sister to escape poverty and emotional and physical abuse from a mom who was herself abused by her husband, was alone with 3 children, unstable income, and just grappling with how to make things work for my mom. My mom escaped, but she escaped to a marriage where violence and food insecurity and poverty and trauma were her reality. And then she became a parent, and they became mine. That lived experience is with me today. You can see in the fact that I get emotional in thinking about it, that it is not something that anybody ever just moves on from and doesn't have it impact the way they see the world, move within the world, or live in it. But it doesn't have to be something that prevents you from living and seeing and moving in the world in a place of grace or beauty. Home was a place where I would walk in the living room and see what was on the table and ask myself if I should try and go out and play or if I would be okay to stay home. Depending on what my dad was using or where he was in a cycle of use, I would do better at school or less well at school. We moved often. I think 22 transitions between kindergarten and grade 10, and I didn't end up finishing grade 10. Home was a place where I saw my mom horribly treated and abused. Home was a place where I put my head on my pillow at night and I would will myself not to sleep because it was safer to be awake. Schools were a safe place. I was the kid, I'm going to show my age, I was the kid who stayed late to bang the chalk off the brushes. And I was the kid who got there as early as I could. And teachers could see me. Because I was one of a smaller proportion of students who were dealing with these kinds of challenges, or one of a greater proportion of students that weren't seen because people were better at hiding it then, or maybe because there was greater stigma or less ability to reach out for support. But whatever it is, I know that I was seen. School was a place where a phys ed teacher came to me and said, "You're on the wrestling team," of all things, when I hadn't expressed any interest in it. I think it was because I did a good job in wrestling class, but I think it's because the teacher saw that I needed to have a sense of place and that I needed to be part of something that was meaningful, because I hung out in the hall a lot longer than I needed to. School was a place where I didn't have the money for a football jacket at the end of the season, but for some reason one showed up. Those things still happen in our schools today because the teachers who teach your children love your children. Through the course of my life in school, people reached out to my family to try and figure out what was going on, and I know sometimes they reached out to authorities, and we moved. I know that I built relationships with people in schools, came to care about and feel cared for by peers and by staff, and then we moved. But each of those experiences gave me a set of understandings about myself. I was lovable because that teacher made me know I was. I learned that I was worthy by people intentionally making sure that I saw it, that I could hear it, that they pointed to things that I was able to do that were awesome. They may not have been awesome compared to my peers, but they knew it had to be awesome for them and for me. And so people, human beings, through intent, through care and compassion, helped carry me through those experiences. We're in a time now in education where being intentional in ensuring that children are seen, being intentional in ensuring that children are given the opportunity to build the skills associated with resilience, being intentional in making sure that they understand the value of connection and that their trauma does not define them, it is part of them, but it is something that they can work with and still have amazing, positive, productive, wonderful lives. That's a mission. So what needs to be done? We need a commitment from all levels of government and the civil servants who serve all those levels of government. Action on what we already know. When you know better, you should do better. We know, in order to address the needs of young people who are experiencing challenges associated with adverse childhood experiences, that we need to be able to provide caring, non-judgmental, robust services to their families so that their families can help break the cycle. We rarely experience a child who's lived with all of these experiences for whom the challenges have been addressed for the adults in their lives. All loving people. This is not about good people and bad people. This isn't about poor people and rich people. Adverse childhood experiences exist in almost every human's life. What differentiates us is how many and whether or not we've been able to get time and stability and resilient skills put into our lives in our hands, and we've been able to practice them. We actually need to engage in a very comprehensive program of intervention where we offer support to families so that they can address their trauma and create more stable environments for their children. I'm not talking about school divisions intervening in the lives of families. I'm talking about school divisions being able to connect families to supports and have those supports be there in a timely way, and be fulsome enough to provide real care for people regardless of their income. Because there are people in our community and communities across this province who can access psychological support when they need it because they have an amazing benefit package or because they have a strong income. And there are many, many thousands of people who need it and access it slowly because they don't have a benefit package and because they don't have a robust income. We know that if young people don't have to think or worry about where their next meal is coming from, they do better in school. We know that if their parents, their guardians, don't have to worry about where their next meal is coming from, they're better able to provide emotional support to their children. We have in our community a service provided by the Root Cellar. We do a lot of work with them for brown bag lunch. During the pandemic, they provided meals to families, and we delivered them with school buses, community working together to address a need. But we know if we can deal with food insecurity, you remove from the plate of challenges that a family and the young people face one source of fear and trauma, you open their minds up to learn. So if we pull together to help families feel more secure in where they live, that where they live is going to be where they can live for a while. If we help families overcome those challenges, then we're going to take another piece of trauma or challenge or fear off a family and off a child's plate. And if we know that down the road, that means that child is less likely to have myriad challenges, physical and emotional, we're saving long-term resources by investing in people today. And we know it's true. People have been saying it since long before I became a superintendent. If you invest in community, then you're going to reduce all kinds of challenges, from incarceration through to marriage breakdown, through to physical and mental challenges. If we just take a look at partnerships and properly resourcing services to families before they arrive at crisis, before their children arrive at crisis. Long term, the cost to our system, the cost to our culture, just financially is one thing, but in terms of pain, is immense. We're in a place in our history as a community and globally where there's so much that we understand about how young people develop and grow, what our experiences as a young person mean to the way we live and experience life as adults. That knowledge produces power. We have the ability to use the power of understanding child development and its impact on adult experiences, the power of understanding generational trauma, what impact grandma and grandpa's lived experience has on mom and dad, and then on us as young people, our students as young people. I'm clearly not one of the young people. We have so much knowledge, and there are so many people who have the will to engage in loving, non-judgmental, caring practices to support families. What we need now is for those who have the resources and have the ability to pull all parties together to do it. What we don't have is a quarterback, and a quarterback who understands the way the resources flow, and we need that. We actually need government to come together again at all levels and across ministries to build coherence for families so that they're not left trying to navigate a system that is challenging for those of us who work in it in order to find the help they need, so that what they hear in community is the same message that their children are hearing in school. You matter. We care about you. Here are the things you can do to build resilience. Here are the things that we can do in order to try and take away some of those adverse experiences that you as an adult are experiencing. While your child is experiencing food insecurity, so too are you. While your child is experiencing argument and trauma and divorce and pain, so too are you. When your child is experiencing the incarceration of someone in their family, so too are you. Your story is not disconnected from your child's. Your stories are connected. The stories of our children are connected to our community. And we do great work in Medicine Hat. Lots of people do great work in Medicine Hat. But we need resources and coordination of those resources. We need to remove barriers, and we need that to become a priority for those who make decisions. And the investment we make today We'll save people from pain. We'll save money. But isn't it more important that you save kids from stories that hurt and allow them to be parents and loved ones who are more likely to bring stability and joy? I think that's who we want to be. I think that's the blessing of my story, is that people saw me and helped give me skills. The blessing in our community is people see that our community needs to change the story. So now it falls to us to pull together and make sure that we write the next chapter in a way that is built on compassion and care and thoughtfulness, and using what we know to do better. To invest in the well-being of families is to invest in the well-being of children. And I know that we can do that. And if we do it, we can see a pathway to better outcomes in all aspects of health for the children we serve today. We have the ability to help our children have a life better than our own because we understand the building blocks of our emotional lives better than we ever had. So why don't we pull together and do some great things about it? We're here and we're ready to go. There are so many willing people. We just need the team.